I'm Ross Camidge. I'm the Director of Thoracic Oncology at the University of Colorado. If you have just been diagnosed with lung cancer and someone is considering operating on you, so you're lucky enough to have had a cancer in what would be called an early stage, so before it spread too far, and maybe it spread to some lymph nodes inside the chest, but not further than that, you might be thinking about an operation. And of course, the question is, there's this surgeon in front of me saying I need an operation. How do I know if that's the right guy for me? So this is hard. Now, obviously, some of it is to do with personality, but you can have a person who's incredibly charming and lovely, but may not be the right person to do the job. So that's only part of it. I would think the questions you should think about asking are, one, are you a general surgeon? Are you a cardiothoracic surgeon? Are you a pure thoracic surgeon? These are tiered levels of expertise. The other one is to try and ask the question as to what kind of operation you're going to do. So are they going to do what's called an open thoracotomy? So that means you're going to have an incision this long where they spread the ribs. That's usually done by general surgeons because that's what you learn in basic surgical training. They're also more likely, if they're a general surgeon, to take out a bigger part of the lung rather than the smaller part of the lung. You can't convince someone who only knows how to do one operation to have the textbook open on your chest and do something different that day. The question is, if your surgeon isn't comfortable, when do you try and move to another surgeon? Well, honestly, the first thing is a surgeon should be thinking about a minimally invasive approach these days. So that's some kind of keyhole surgery. It can be done by what's called VATS, video-assisted thoracoscopic surgery. So that's done with instruments held by the surgeon that go in through maybe about 3 incisions, each of which is only about an inch long. Or even something a level above that, which is called rather attractively RATS, which stands for robotic assisted thoracoscopic surgery. And the only difference is that the arms don't have the surgeon's hands on them. They're actually operated by a robot. And then the robot is operated using a joystick by the surgeon who's sitting on the other side of the operating room. Either one of those is fine. But I think if you go to a surgeon and they say, look, I do an open thoracotomy and I've been doing it for 20 years, that's fine. But if you get a choice, you might want to think about at least getting an opinion from a different surgeon. And if you're going to get an opinion, try and go to one who's a pure thoracic surgeon. That's my 10 cents.